So we're going to talk about hair today, gone tomorrow. Yes, this is something that people really associate with men, but it's not about men. We're going to talk about this a little bit. So I want to go through some of the myths that we hear out there, because there's all kinds of home remedies. There are all kinds of things on the market. People telling you to take this, rub this on your head, everything from peptides to castor oil. So I want to sort of tackle it from a scientific point of view, tell you what I've learned over the years, what works for my patients. I've really revamped our hair restoration protocols because we've always done hair transplants, but it is really about the hair loss and hair maintenance and preservation that I really care about. And I think most of us do. Nobody really wants to have surgery. So, just checking. Okay. So, yes, hair is not just, to keep the top of your head warm. It has a ton to do with our personality, with the image that we project to everybody. Women know this incredibly well. So do men, though. There's really no difference. And of course, there are people that lose their hair for whatever reason or thin their hair, and they try to make adjustments. But in reality, most people are happy to have a full head of hair, and they'd like to go through life with that full head of hair and then and keep it. Like I said, men, it's just as important, whether you're a young guy, whether it's a sign of virility, whether it's a sign of youth. We really care about the way we look, and hair is one of those accents that are really important to our self-image and the image of those around us. Now, there are plenty of people that age gracefully. I mean, these are probably two of the best heads of hair in Hollywood since I've been a kid. And they do, they don't seem to have any trouble with their hair. Most of us would love to have a full head of hair like that at their age. I think both of them are well into their 70s. Sam Elliott's probably even closer to 80 by now. Still incredible head of hair. So that would be the ideal, but unfortunately that's not the case. Some of our greatest heroes, you look at Sean Connery and John Travolta, they tried to keep their hair, but didn't work out that way. So, yes, some people look good with a shaved head. Not everybody does. Here's an assortment of men that have hair issues. I mean, here's The Rock, who even knew he ever had a head of hair. But everybody would love to have a full head of hair. And we're going to talk about how to keep what you have, restore what you may have lost. Let's see. And here are a few women that have different stages of hair loss for different reasons. We're going to talk about what kind of reasons would cause Tyra Banks or Naomi Campbell to have hair loss. So this is going to be traction alopecia, which we'll talk about. But all these people struggle with hair loss, hair thinning, and for a variety of reasons. It's not just a male problem. John Cena, he came out and he sort of not really confessed that some people think he might have been bullied by his fans because they were making fun of his bald spot that he had. But he decided to go, and he has no problems talking about it. He decided to first try hair preservation, and then he decided that he really wanted to restore his hairline and get rid of the bald spot completely. So he did everything. And we're going to talk about the program that he's on because it's very similar to what I've developed myself. So his routine is red light therapy, minoxidil, vitamin, shampoo, conditioner, but he also got a hair transplant. All those things we do. Not all those things are necessary for everybody, especially women. Women very rarely ever need a hair transplant. It can happen. Of course, it can happen, but it's not always necessary. Women tend to lose their hair in a more diffuse way. There's a different sort of pattern, which really starts in the center of their head, if they have a part in their hair, but sometimes it can be from the temples. And yes, they can have some people do have a male pattern type baldness, but generally it's not as severe as in localized in one area. It's a generalized thinning, and we can talk about why that happens. So the common types of hair loss are alopecia is what we talk about. That's the official word, alopecia. There are some big ones, and we're just going to go through the big ones so that you can understand, especially if you're struggling with hair loss or hair thinning, really to give you an idea of what could be wrong and what you can do about it. So there's diffuse hair loss, there's alopecia areata, there's traction alopecia, trichotillomania. So this one is one that happens very often, telogen effluvium, and sometimes people all of a sudden start to feel like their hair is thinning like rapidly, all of a sudden. We usually lose between 25 and 50 hairs a day throughout your life, where you see them in the sink. It's not a big number considering the amount of hairs we have, but in telogen effluvium, you can lose as much as 300 hairs in a day. That quickly becomes noticeable. And it's usually due to a shock in the system. It happened a lot during COVID-19. So illnesses can do it. Postpartum, the stress of having a baby, stress in general, stress from your work, from finances, from relationships, from war, from whatever. Stress will cause you to have, in some people, if you're predisposed to, a telogen effluvium, which is a diffuse hair loss. It's not in one area. Medications can do it. Some blood pressure medicines can do it. Some hormone medicines can do it. And rapid weight loss. We're seeing more of it in people who are going on some of the semaglutides, the whether it's tirzepatide or semaglutide or Wegovy or any of these, Ozempic, any of these drugs that are doing wonders helping people lose weight. But generally what happens is they lose weight very quickly, and their appetite has decreased so much that they're not getting enough nutrients, and they're basically stressing their body tremendously. That manifests itself in different ways. Their protein levels go down. You see their skin sag. Yes, they lose the weight, and their blood sugars go down, so it's treating the diabetes, and people are happy with that. But there are some side effects, and one of those can be hair loss. This is alopecia areata. This is an autoimmune disease. It's a genetic trait. It does come out in patches. It can be somewhat diffuse, so you have to make sure it's not telogen effluvium, and it can be total. And treatment is usually aimed at controlling the autoimmune response. Once it's diagnosed, then we stimulate the hair growth through topicals, and we try to improve the immune system. But basically, the hair follicles are stuck in a resting stage, and they don't grow, so you have to stimulate them. But that's why it's so important to have a diagnosis. And sometimes just going to places where they tell you they're going to restore your hair, and they don't do any testing, they don't try to figure out the causes, you can waste a lot of time and an awful lot of money. Traction alopecia happens in many different kinds of people, but generally it's called traction because it's a type of hair loss that's caused by pulling or tension on the hair. So some hairstyles like ponytails, dreadlocks, tight braiding, even some hair bands will cause pressure on the hairs, and they're pulled constantly, and that will cause those hair follicles to die off or to go in a stage where they can't repair themselves. So obviously the treatment for this is going to be first stop pulling the hair, so stop using those hairstyles. But we may have to give topical steroids to bring the inflammation down. Sometimes patients need antibiotics because there's sores. And we use the topical therapies, which we're going to talk about, because the kind of topicals for hair growth are not just run-of-the-mill like everybody wants to talk about minoxidil. There are different ways to approach this. Trichotillomania is a problem that is more of a psychological problem. It's known as hair pulling disorder. It is a mental health condition. People have an irresistible urge to pull on their hairs. It can be their hair, it can be their eyebrows, it can be their mustache. It can happen anywhere. And this is something that requires treatment. It requires a lot of compassion and support. These people can feel very isolated, but they do need professional help. And sometimes we do need to treat the hair loss to help restore it once the pulling has been treated. So again, these are some of the main ones that there are others, but it is important to understand that not everybody that has hair loss has the same problem. Now, here's probably the poster child for the bald-headed man. And this is male pattern baldness. Now, there is a female pattern hair loss, which we're going to talk about. But this is the most common sort of hair loss in both men and women. Yes, we have those other ones that I just mentioned, but female and male pattern hair loss, or androgenetic hair loss is what it's called officially, is hair loss that is lost at a specific pattern. And that is a progressive condition. This doesn't stop. So in other words, it may be in the front, it may be on the sides. We're going to talk about it. It's usually not on the sides. So in men, due to genetics and age and hormones and stress, some medical conditions, some medications that you might be on chronically that can thin your hair, recreational drugs. People don't realize that, marijuana is a notorious reason for people to lose their hair. Everybody now it's legal. They buy some gummies, but they don't know that they're actually causing some hair loss in both men and women. So, but these are the patterns in men, and there are different systems to classify it depending on what areas of the scalp are thin. You may just have something in the occipital area, or you may be losing it in your temples, or both, or sometimes there's even a little patch in the front. But these are classified differently, and it is important, but they will progress, and they can be stopped earlier. So now, again, this is a progressive diagram of what happens in some men. They may start a little bald patch in the occipital area that starts to widen. They start to recede in their hairline. Eventually, that bridge will meet. But generally, the hairs on the side and the back of the head are left intact, and that helps us in the patients that actually need hair transplantation. That is a gold mine for us, because those hairs are genetically programmed not to fall out of your head. So we use those hairs one at a time. We transfer those and bring them to the areas where they're needed. Generally, we try to start in the front of the hair where it's most noticeable and build our way back. Depending on how big the area is where you do have hairs, will determine how many hairs we can transplant. But that's for patients who need transplant. Now, in women, there is a different kind of pattern. Yes, there are women that have male pattern baldness, and there are men that have female pattern baldness. But generally, this is the case. Women tend to lose it generally right in the midline first. It gets thin there if they're going to get female pattern hair loss. And it progresses where you see thinning right down the midline, and it can become almost like, some people call it a Christmas tree classification, because it begins to look a little like a Christmas tree. It's wider in the front, narrower in the back, and then it becomes almost the entire top of the head. Obviously, we don't want to get to that place at all. But there are many things that we can do. Again, the same reasons that they happen in men happen in women. The same. Now, obviously, there's some different drugs hormonally, but for the most part, genetics, age, hormones, stress, that's physical and emotional stress will do it. But illness can do it. Like I said, we saw a lot of it during COVID, and we still see a lot of it after pregnancy. Postpartum alopecia is very common, and women usually are so stressed out with trying to raise the baby that they don't notice for months that the hair is thinned as well. So this is what female pattern baldness, if left to progress, starts to look like. You start to look just diffusely thin. It's not quite the same as in a male where you get actual bald spots, but you do see this sort of thinness. Everything is just farther apart. But again, the proper diagnosis is crucial to treating it, because if you get the diagnosis wrong, you get the treatment wrong. The culprit in both male and female pattern baldness is DHT, dihydrotestosterone. So basically, dihydrotestosterone is a product of testosterone breakdown. It's a male hormone. Yes, women and men have male hormones, as just as men have female hormones. But the male hormone is obviously it builds muscle. It has a role of sexual development and other bodily functions, but it contributes to hair loss because that DHT product starts to inhibit the hair growth at the follicle. It actually, that hormone, when it bathes the base of the hair follicle, it will cause that hair follicle to go into the resting phase, and eventually that resting phase becomes a permanent phase for it. So again, it is the same reason in both. The DHT is causing the problem. So that's why some of our topicals, some of the treatments that we use are aimed at decreasing the amount of DHT. So with all that said, this is why it's so important to get the right diagnosis. And this is why one of my pet peeves is people who just blindly go to someone who says, I'm going to give you this product, try this. I'm going to take this nutritional product, try that. If you don't have the proper diagnosis, you will spend a tremendous amount of money, because all these things are expensive, and you're going to spend your valuable time. Remember, these hairs that are programmed to die are on the way to dying. So it is actually a matter of a race against time. How many can you save? How many can you get to go back? And how soon can you make that happen? So you do have to work at it. And so this is why I've put together this program where I've taken the best science that we have, put it together in a package so that you don't miss out on anything. So what is it including? It includes a comprehensive, that's misspelled, God, I apologize, comprehensive consultation. And I really mean that. We will go through your entire medical history. You will see me, or you will see Dr. D, who is a board-certified internist who specializes in anti-aging medicine. We go through all that with a fine-tooth comb. We're looking for clues. We want to know your family history. We want to know your genetic profile. We want to know what's going on in your life to see what factors are contributing to your hair loss. And because it may be a mixture of things. Yes, you can have genetic predisposition to hair loss and also be under stress. So it's not like it's just one thing. So we want to make sure that we really attack everything at the same time to give you the best chance of restoring your hair. Because again, not everybody looks good with a shaved head. So the first thing we're going to do after this comprehensive consultation, which is at least an hour, by the way, with labs and everything else. We do microscopic trichoscopy, which is using a device similar to this. Actually, that's very similar to the one I use, where we look at your scalp, and there are clues. And I'm not going to go into a big scientific discussion of it, but there are things that you can see under there, not just the amount of hairs, but you can see which hairs are dying. Our hairs that normally should be 3 in a clump are decreasing to 2 or 1. Is the hair shape, the shaft, is there a wrong shape to it? Some types of alopecia, the hair looks like an exclamation point. It's thin on the bottom and fat on the top. All those things. Could there be a fungal infection? Could be something simple that maybe you just have a little fungal infection in your scalp, and that's causing your hair to thin, and we just give you a little topical medicine, kill it, and you're done. So it's so important to know what you're doing. You can't just blindly start taking your Nutrafol over the counter and start taking tons of vitamins and all that and just, throw it all against the wall and see what sticks. We're well past that. The science is well past that. So that's why what we do next, and this is most important, DNA genetic testing for hair loss. So what we do is we take a swab, an oral swab in your mouth, and we send that off to the lab. What they are going to do with that is do a whole genetic test. And I'll show you what that report looks like, because what we want to know is what type of hair loss you have, but we can also now determine what kinds of topicals you are going to respond to. We're going to give you low-level laser therapy. So that has been shown, and there are tons of studies about that we can increase the growth of your hair and preserve the hairs that you have by the right wavelengths, and it has to be 6 to 630 nanometers. There are tons of people selling all kinds of weird lights, and they're just red. They're not doing anything. They got to be the right wavelength. Again, we're going to have customized topical pharmaceutical therapy. So based on your DNA and on your history, we're going to make the topicals that will work for you. We're going to use platelet-rich plasma, which we'll talk about more, and then we have some other things that we can add to it. This is the basic program that when you start with us, you're going to get 3 months of therapy, including all that in one package, because this is what works. So this is a trichoscopy. So you see here, you see these thin strands. These are hairs that have atrophied, and some of them are coming out. So you see some that are single hairs. If you look at a child, I'm not going to go through all this, but if you look at a child, you have doubles. Sometimes you'll see triples. Let's see, we see any triples. There's a triple right here. So we have, when we start out life, when we start growing and we're young, our hairs are 3 and sometimes 4 shafts coming out of one follicle, one follicle. But as we start to lose our hairs, you'll start to see some of these become thin. They start to shrink, and they start to lose the shape, or they may have some other things going on in the scalp itself, which are other issues that we look for in the trichoscopy. So it's important to have a good trichoscopic analysis to see what stage you're in and also what we can do to fix it. So the DNA genetic testing that I talked about, we're going to get a handout that looks like this, and when you have yours done, you'll see that it'll give us the vitamin, minerals, and antioxidant supplements that you are going to respond to. It's going to tell you, will you respond to minoxidil or not? Because not everybody does, and you know that because you've tried it. I'm sure you have. If you're listening to me, you probably tried it, or you know people that have, and sometimes it works, sometimes it doesn't. Or should you be taking finasteride or dutasteride? The thing is, you can take all kinds of things or mix it in a potion and put it on your head. But if you're not a genetic responder, then you might as well be putting water on your head. So we're going to tell you exactly what things will work based on your genetic profile, and it's completely accurate. So the topicals that we give you are designed for you, and believe me, everybody's bottle that they get to put on their head is not the same. It is based on what we saw from the genetic sampling. And then the low-level laser. So yes, we're going to be using light treatments like that, and it's a low-level laser, doesn't burn. 30-minute sessions. You do them as often as you can, but we really recommend twice a week is ideal. And again, our machine gives you the exact wavelength, which has been proven, and there are tons of scientific papers. It has to be in the 600 to 630 wavelength, otherwise it doesn't work, and it will stimulate growth. Next, we have platelet-rich plasma. So platelet-rich plasma, we take your blood, we spin it down. This part of the plasma is loaded with platelets, but platelets are in turn loaded with growth factors, and incredible growth factors. It's your platelet-rich plasma. It comes from your body. We spin that down, inject it into your scalp, into the areas where you're losing hair, and we do that 3 times, separated by 30 days, and then we wait 6 months. But you will see a result after those first 3 treatments, and we can even supercharge that. We'll talk about that a little bit, but this is a great treatment, especially in the early stages, because not only will it cause you to grow hair where you may have lost some, but the hair that you have that is in the process of dying, because it's genetically programmed to do that, will start to restore itself. So that's why we like to call this preservation program, because we're trying to preserve the hair that you came to this planet with and let you keep it until you leave. The optional things that we do add on, and we call them optional because those things that we talked about, I think, are essential. You can get by with those, and you do it as a 3-month program. That's great. But if you really want to supercharge it, I love exosomes. Exosomes are little cell particles that that are harvested from umbilical cords of fetuses. Okay, they're not from the baby. These are, so PRP, the platelet-rich plasma that we talked about, has thousands of growth factors in it. Exosomes has millions of growth factors in it, things that will stimulate the cells that make your hair strong. And we inject that. Usually it's only 1 or 2 treatments. Most people get 1 and done. So that's why I say we can supercharge your PRP. We can mix it with PRP. There's advantages to that. We can also add medical grade shampoos, which gives your scalp, the best conditions in which to flourish. Hormone therapy. When we did that first analysis, that first consultation, we were going to pick up any hormone abnormalities that you may have. And that has to be treated because, for example, if you have polycystic ovaries as a woman, you are going to have hair growth problems. You're going to have testosterone problems. You're going to get hairy in places that you don't want to be and lose hair in places that you want it. So it's important for us to diagnose any conditions that might be causing your hair thinning. IV therapy, especially if you're under stress, especially if you are deficient in anything, we will intravenously give you the vitamins and minerals that you need, but we can also add some of the newer polypeptides, which may increase hair growth in your condition depending on your genetic profile. And you can add additional PRP packages. But these are the optional ones. The first stuff we talked about, those are essentials. I love exosomes. I think they're all awesome. And I'm going to show you some pictures. So when you do this, here's one treatment with exosomes, one treatment after 6 months. And, yes, still thin, but that's just exosomes, not mixed with anything else. That's why I'm saying if we have science that proves that all of those little things, whether it's genetic profiling for the right topicals, topical treatment, PRP, light therapy, if we're doing those things all together, then the sum of the parts is greater than the whole. Is that what it's called? The whole is greater than the sum of its parts. So in other words, adding each one together, they all work in synergy so that you get a much better result. So if you just get this with exosomes, imagine what you get if you mixed everything else. And this is the sort of thing that can happen. This is one treatment with exosomes. I also did PRP on him, but one treatment. And this is after 3 months. So why wouldn't you? I see famous people. You look at Prince William and you say, well, I know you're proud. You want to just be natural, but you're a young man. Why would you not try to save every hair that's on your head, especially if you happen to have tons and tons of money? So none of this, by the way, is like a hair transplant. None of it is going to cause any downtime. This is the kind of treatment you come in, we do it. It takes about 15 minutes and you go home. It's not a big deal. Nobody knows you're doing any of these treatments. Here we go, exosomes and PRP. You can see how this area that's just thinning is now growing together. And this one is one that had the complete therapy, 3 months of PRP, the laser, low-level laser, the topicals, genetic testing, the topicals, by DNA testing, as well as exosomes all together. She's got a full head of hair. This is male. This is a female. This is a male. And this is another one, the full treatment, topical treatment, light treatments, PRP, exosomes, all together. And you can see here's her before, here's her after, here's his before and his after. And you just have a full strength, a full-on head of hair like you used to have. So the point is that this is just light therapy, by the way. So light therapy, and this gentleman did it for twice a week. It's hard to do, but it takes 30 minutes. You bop in, we set you up with the light, you read a book, you listen to music, and then you're out of here. So there's no waiting. It's not like you have to wait to be seen by anybody. We just put you on the laser and you get your treatment, and that's it. So this is just with light. You saw what happens when you combine everything. This is a gentleman that had a transplant before we had other things to offer him. Now, so he got some nice results with his hair transplant. He needed a lot of hairs because he was losing so much. His hairline was definitely improved. However, Now he's on topicals and light therapy, and he's doing much, much better. Same thing. Now this is with he did get a hairline transplant in addition to topical therapy, which he's religious about doing. So people pick and choose sometimes. That's why I put it together as a package, because it shouldn't, and we made it very affordable, because it shouldn't be about what you want based on the price. It should be what's going to work the best. So we've made it really easy to have all of it in one treatment plan. Again, this is a mixture of all the components with a little transplant in the front, just 1,000 grafts, not very many. Usually when we do hair transplants, it's over 2,000 to 3,000. Some places go even more. I don't like doing so many in one session. This is a hair transplant. Really great gentleman, but you can see how thin he was here. We filled up his hairline. He's loving it. So some people will just go straight to a hair transplant. They know what they want. But even that, he's still on nutritional therapy. He still was on topical treatments. This is low-level laser after 3 months. See, before he was complete, and this has all come back just with the low-level laser. So this is the package. This is everything that I mentioned: comprehensive consultation, the hair loss, DNA genetic testing, low-level laser, DNA-guided therapy, the topicals, PRP. We get the trichoscopy analysis to make sure there's no medical issues in your scalp. All of that is a 3-month program, and if you scan here, you get $150 off it, and if you do by firm, you pay $132 a month. It's pretty simple. So that's really it. I wanted to let you know what we were doing, but also to let you know that there's so many things out there, and sometimes you just need someone to clear through all the clutter and tell you, this is what you need, this is what's going to work. It'll work on you because it's made for you, not for a million people. So if you have any questions, I'm here. You can ask me a question. I'm happy to answer. And you can contact us on our phone, or you can do the QR code, which will take you to where you can purchase the program on it. But I'm sure you're going to want a consultation, and I think that's the best way to go. But if anybody has any questions, please feel free. I'm assuming that everything's working. I know I sort of spoke quickly about a lot of different things. Is there anything in particular that you'd like me to explain a little slower? Like I said, please feel free. Okay. Well, then I'm going to let you guys have the rest of your evening without me yapping at you. And please give us a call. Like I said, men, women, it really doesn't matter. And I really feel glad that, you joined us. And I really appreciate the time you've given me. So have a great night, everybody. You did PRF and Nutrafol to no avail. All right. So if that's the truth, then I'm very happy to go over your complete medical history with you, order some tests, do some DNA testing, and figure out what it is you actually need, not what people are trying to sell you. And that's really the key, trying to give you what you need, and not just, this isn't just marketing. Okay, so everybody's got something they need to sell. I'm giving you everything, but it's going to be customized for you, and that's what I feel people need. That's what I would want for myself. Okay, so I'm going to sign off. Good night, everybody. And again, thank you for coming. Let's see.